Joining me now, Dr. Vin Gupta, an MS Now medical contributor, pulmonologist, global health expert, and also on the National Board of Directors of the American Lung Association. It's good to see you, Dr. Gupta. What does this change in policy mean for the health of everyday Americans?
Well, Chris, there's probably some watching right now that lived during a period where the Clean Air Act, first passed in 1977, didn't exist. And what happened then? There was acid rain. There was smog-filled cities, far worse than what we see on a bad air quality day. And that resulted in hundreds of thousands of people going to the hospital with an asthma exacerbation, with an exacerbation of their heart disease. And there's real health consequences. And now, effectively, the whole mission in charge of the EPA, Chris, it's unclear what their mission is anymore, because the whole purpose of that agency is to really effectuate the Clean Air Act and to make sure that it exists. And what we're seeing, yesterday's announcement is essentially saying that the Clean Air Act no longer exists. The greatest public health, you could argue, greatest public health federal achievement no longer will apply.
Well, they argue, the EPA argues, that the previous cost-benefit analysis wasn't good. They said there was too much uncertainty in those calculations. Is it impossible or nearly impossible to actually quantify health benefits?
No, and we've actually seen this in the data. This has been modeled with the very best data, and there is always some estimation involved here when you're making policy. But we're seeing with the very best models that what the data here that they're actually leveraging to estimate these health benefits is the actual air quality, Chris. We're seeing improvements in air quality and levels of air pollution that are improved by about 70%. Our air is about 70 to 80% cleaner than it was about 50 years ago. That has clear health consequences. And so there's not fuzzy math here. There's a clear input and a clear output. We're seeing 230,000 premature deaths prevented annually because of the Clean Air Act. Asthma exacerbations, hundreds of millions by the middle of this decade, ending up in the hospital with a breathing problem. This is because we have cleaner air now because of the Clean Air Act.
California is actually taking state-level action on pollution. They recently tripled penalties for major air quality violations. But of course, not everybody lives in California or a blue state that might have tougher environmental laws. So how does the average person go about combating this? I guess essentially protecting themselves.
It's a well, if we don't have elected officials at the state level, you mentioned California, they have EV mandates by 2035. They have stringent penalties now for polluters, corporate polluters. They're doing really important work when it comes to making sure that heavy duty trucks limit their emissions of emissions from diesel gas powered machinery. So we're seeing a lot there at the state level, not just in California, but also in purple states. But that's what it's going to take, Chris. Unfortunately, we're going to have to see massive action at scale to protect individual households. I will say, if you're watching this and you're worried, it's always important to understand, especially during summertime, what is your air quality. If you're seeing a sort of a fuzzy skyline, if you're feeling like you have breathing problems, if your eyes are getting irritated when you're outside, check airquality.gov. You can get your air quality index there, airquality.gov, and just to make sure that you're protecting yourself.